Welcome, everybody. Today's lecture is going to be about social determinants of health. Believe it or not, these impact your life every single day. So, we are going to learn a little bit more about it in this week. Here on my screen, you see the social determinants of health model created by Dow Green and Whitehead. Before, you never heard about this. Now, social determinants of health have exploded. They're everywhere. You hear it in regular conversation when we're talking about health, and doctors are even implementing it in their practices. So, if you are a health major or a health student, a nurse, physical therapist planning to become a coach, whatever, a psychologist, you will be operating out of a social determinants of health model. That's how important they are. A lot of research has been done on it. So let's take a moment and dive right in. Okay, here we go. This outer arc shows parts of the social determinants of health that an individual has control over, some type of control. And the further you move inwards, so the further you move inwards on this model, the less a person can control. So let's start from the middle and work our way out. In this middle part, we can't control it. We can't control our age. We can't control our race. These are things that we are born with. You can't control the sex that you are born with, although you can change your gender now these days, but you cannot control the sex that you are born with. There's a difference, which we'll learn about later this week or later this class period between sex and gender. Anyhow, these are items that you're born with. Now, as we move further, individual lifestyle factors, these things you have within your control. You can decide whether or not you're going to drink, you're going to smoke, you're going to exercise, you're going to eat right. You, as an individual, decide what your individual lifestyle factors are going to be. And all of these factors have a direct impact on your health. So, social determinants of health have a direct impact, causal impact on your health. Your social and community networks also have an influence on your health. So, whether or not you have friends, whether you're not you have a social network, even something going to church has research has shown has an impact on your health. And then you start to move out to the outer layers, and these are factors, the social determinants of health that the individual does not have in their control as much. And it's very much contingent on how rich or poor you are. So, for example, your housing, where you live matters. And where you live very much depends on how much income you make. You can want to live in Beverly Hills all you want, but if you're not making Beverly Hills money, forget about it. So, your housing has a direct impact on your health. And housing in America, especially in America, has a direct impact on your education because your schools are funded by zip codes. So zip codes matter. And typically people who grow up in the poorest zip codes have the poorest health outcomes. So your living and working conditions, your work environment also matters. If you have a job where you have very low job demands and very high job demands and very low job control, which we'll learn about in this next week, then you're going to have a lot of stress. It has a negative impact on your health. If you are chronically unemployed, and it's not because you have just bad health, it's going to have an impact on your health. If you have poor access to good water, like the people in Flint, Michigan, or in other parts of America, that's going to negatively impact your health. And then you just have these general socioeconomic, cultural, and environmental conditions that also have a large influence that the person has no control over. So all of these factors, like the neighborhood you live in and how green it is and how safe it is, you can't control how safe your neighborhood is or how green your neighborhood is, but those factors, those social determinants, have a direct impact on your health. So that's social determinants of health in a nutshell. So let's take a look at this next slide where it talks about a basic definition from the World Health Organization. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at a global, national, and local levels. So again, power shapes neighborhoods, money shapes neighborhoods, and those have a direct impact on your health. Centers for Disease Control, the CDC, has their own definition, saying that social determinants of health are the conditions in which people live, learn, work, and play. These factors profoundly influence the health of individuals and communities in the United States. So let's imagine that you live right next door to a refinery. Very easy to imagine because of where we're located. A refinery is right next door to Lamar, and the football players play on that field right next to the refinery. So, social determinants of health, it's where you live, learn, work, and play. Lamar is a perfect example of being a social determinant of health because a lot of college students live at Lamar, they learn at Lamar. Some of them have jobs, they're working there, student workers at Lamar, and some of them are playing there as well because they're student athletes. So, these are the conditions. So, how well your school is handling different factors related to social determinants of health. So that setting right there has a huge impact on your health. So among the various social determinants of health, food insecurity has one of the most extensive impacts of the overall health of individuals. So if you are living in a food insecure household, then that's going to severely impact your health. The US Department of Agriculture found that food insecurity affects 11% of US households. Moreover, individuals who are food insecure, this is why it impacts your health. You are disproportionately affected by chronic diseases, including diabetes, high blood pressure, and obesity, which exacerbates adverse effects on overall health and well being. So, let's think about people living in poor neighborhoods. When we looked at that chart, that social determinant of health chart, if you go back to there, you see individual lifestyle factors. So that's how you're eating. You have control over what you put in your mouth. However, if you are poor and you live in a poor neighborhood where you don't have easy access to a grocery store that offers you healthy food choices, your nearest store might be a dollar store, not even just poor, but also rural communities. Your nearest access might be a dollar store. At that dollar store, you can't get fresh fruits and vegetables, just not possible. So let's imagine you don't have a car. So getting to the store is a challenge. So your first thing that you're going to do probably, which is easiest, is walk up or bike up to that dollar store or to the McDonald's or the Burger King or the Church's Chicken House, which is right in that community. Poor communities typically have tons of unhealthy eating options that are super affordable for a poor man's wallet, and so then you're going to see higher level of diabetes, hypertension in these communities because that's what they have easy access to. And in rural communities it's the same because you just have the dollar store out there. So that's why food insecurity is a big social determinant of health, and also living in a food desert is a big social determinant of health that directly impacts your health, because living in a food desert or living in a food insecure household, it's not something that the individual alone can control. So social determinants in health and nutrition, reflection on the role of the communication. This is an excerpt from an abstract by the scientists here, Viswanathan. So what they write is that a healthy diet is considered a critical pathway in influencing chronic conditions such as hypertension, diabetes, cardiovascular disease, cancer, and obesity. So if you have a poor diet, you're going to increase your risk of these chronic diseases. And the current information environment around diet and nutrition is complex and often confusing to the public. though considerable evidence suggests that successful public health communication campaigns can promote health and prevent disease. So we know that if you give a good nutrition campaign about healthy eating, it works. However, studies also show that this success is subject to the influence of social determinants, such as social class, social network, race, and ethnicity, and also neighborhood. So what that means is that if you want to have a successful communication campaign where you're helping people eat better, which a lot of people who work in public health do or want to do, or even in global public health, what the studies are showing is that social determinants has an influence. Uh, so it's a little bit harder to implement these types of communication strategies to get people to eat healthier when they're living in a certain neighborhood or from a different social class or et cetera. And so that's um, what this is saying. So the next slide shows how social determinants of health and COVID-19 have been a big factor for during the COVID-19 pandemic. So what we have seen is that poor communities suffer most. So as the virus spreads, the combination of large rural populations with high rates of underlying health conditions will create the perfect storm for COVID-19 to have devastating effects on rural America, particularly in the southeastern parts of the US. And this is sourced from an article looking at the devastation impacts of COVID-19 in rural communities. So what we have seen is that your essential workers are typically living in poor neighborhoods, and a lot of them are Latino, Black, and Brown communities. And so we saw that these communities already, what social determinants of health teach us, are struggling. They're already food insecure. They're already food deserts. They're already having higher levels of chronic diseases like diabetes, hypertension, etc. They're already in poor environmental conditions, and then they got hit also with COVID-19. And so COVID-19 spread through these communities. They have also, social determinants of health show us a harder access to healthcare. And if they do get healthcare, it's not always great. And this is showing how social determinants of health and COVID-19 have intertwined. So we have seen on a national level the importance of social determinants of health, how where you live matters for your health. We've also seen, if you watch the news, how different countries have handled and tackled COVID-19, with some countries doing better than others. So it's not just about the neighborhood of where you live matters, it's also the country about where you live matters and has a substantial impact on your health and your life expectancy. Thank you very much. I hope you got a lot from this lecture and how social determinants of health are super important and why they matter. And perhaps if you go off to be work a health professional, you will watch that video from this week, because this woman, doctor, shows how she's using social determinants of health in her practice. So for example, when she's talking to someone who she knows is living in a food desert, she knows that she has to tailor her message to that person, because it's not going to be easy for that person to go eat an apple to get healthier, or somebody who's living in a dangerous neighborhood. It's not going to be easy for them to go out and take a walk to work on their obesity levels. So she's having to tailor her message. So I invite you to listen to her video this week, and just think for a moment of how the different social determinants in your life have impacted your health. If you have any questions about today's lecture, feel free to send a message to me. I look forward to next week. Thank you. Have a nice day. Bye-bye.